Diagnostic ultrasound is a rapidly developing imaging technique widely used in both industrialized and developing countries. It is an indispensable tool for the practice of obstetrics and in the management of disorders of the female reproductive system. Moreover, it is gaining wider acceptance in the area of general surgery. Dr. Kenneth Tayler started incorporating ultrasound scanning into his practice in 1972 and has written several books that have been used to teach ultrasound scanning techniques all over the world. Dr. Tayler estimates that at the Yale University School of Medicine, about 25,000 abdominal, vascular, and gynecological examinations are performed each year.
It is an immediate diagnostic procedure which can be used for a wide variety of different problems. And that is why I think it could be expanded into the primary care, into surgeons' hands, into internists' hands. It allows you to see any normal structure in the abdomen, at least affecting solid organs such as the liver, spleen, kidneys, gallbladder. You can see whether there's dilated ducts and infer whether there's any blockage to the biliary tree. You can give a reasonably good opinion about where the blockage is, the anatomic site. Indeed, that's one of the earliest applications that I ever used it for. It enables you to diagnose aortic aneurysms, for example, and follow them to see if they're getting bigger and time surgery for them. I think an important area is in the emergency room, and they've suggested doing this, that when somebody comes in and they don't know whether they've got an aortic aneurysm which is leaking, and that's an indication for CT, but if you do a quick ultrasound and show they don't have an aneurysm, then it won't be leaking. Kidneys, we see people in acute renal failure, for example, and we want to know whether the kidneys are obstructed or whether it's intrinsic renal disease. We can tell that with about a 99% accuracy, but with ultrasound. We can look at more sophisticated things like renal artery stenosis is another cause of acute renal failure or hypertension. This list goes on. It's a very lengthy list, obviously, but if I can just give you the idea that in any of these solid organs you can look normal anatomy, you can look at abnormal space-occupying masses, things that are displacing organs, for example, tumors of any of these organs. We're talking about acute infections like pancreatitis, abscesses. You can drain abscesses under ultrasound guidance. That's what it really is. It's the first line imaging technique for a wide variety of conditions in the abdomen. It's very fast, very good information.
This program will discuss the standards and protocols of abdominal ultrasound. After viewing this program, you should be able to explain the American Institute of Ultrasound and Medicine scanning protocol for renal, hepatic, abdominal aortic, and splenic exams, discuss the criteria for recognizing the normal and abnormal appearance of renal, hepatic, abdominal aortic, and splenic structures and artifacts in two-dimensional imaging, and describe the criteria of appropriate probe placement and beam angulation to obtain the best images. If an ultrasound exam is scheduled in advance, it is important to have the patient properly prepared. For upper abdominal examinations, patients should be fasted overnight and scanned early in the morning. For semi-urgent scans, a fast of at least 4 hours is necessary to obtain dilation of the gallbladder. Fasting also helps reduce bowel gas, which can obscure anatomy. Dr. Tayler uses a broadband curved array transabdominal transducer, C42 or C52, for his abdominal ultrasound examinations.
It's been shown over the years that you need broadband transducers to produce maximum or optimal resolution. And in fact, the high frequencies will image the superficial tissues best, And then those high frequencies get absorbed as you go down, and then the low frequencies would demonstrate the deeper tissues. This is just like sound, you know, if you listen to somebody playing next door, it's the bass that comes through the wall, and so it's the low frequencies that are left to image the deeper tissues.
Before each exam, Dr. Tayler makes sure the transducer he uses is thoroughly clean. He then applies a typical ultrasound gel to the scan face.
We just put it around like this on the transducer, or you can put it on the patient where you're going to scan. And the reason for that is we cannot put ultrasound through air. And that's one of the limitations with the gut. It contains air, so you can't get through it. But if we have this material between the skin and the transducer, this will now produce a good image.
To obtain the best image using an abdominal probe, make sure you're using an adequate amount of coupling gel, and make sure the face of the transducer is in constant contact with the patient's skin. To gather all the information you need, go over the entire abdominal area, longitudinally, transversely, and obliquely as necessary to cover the entire organ that you wish to scan. A basic AIUM renal exam involves the investigation of the kidneys. A normal kidney will be approximately 11 centimeters long with a distinct white line around it, the perinephric fascia, with varying amounts of white perinephric fat. You will see white lines in the center, which is the collecting system.
Okay, so that's a very nice looking kidney there, scanned actually intercostally. There, we can measure it, we can exclude hydronephrosis, a little breath in there. Let it out a little bit. Okay. Okay, we're getting a little artifact there. This is actually, this is true here. There's a little bit of fat that comes in here, which is an embryologic remnant that you shouldn't worry about because it's seen in everybody. Okay, so that's the right kidney. You may see some enlargement of the adrenal gland, which you see immediately above that. Now what I'm going to do now is go a little bit further down and show you how you can use this intercostal scan quite nicely to look at the right kidney. Here is the right kidney. First of all, we want to measure the total length of the kidney. You can see the kidney, just breathe in and out, the kidney moves a lot with respiration, in and out, okay. It has surrounding at the perinephric fat, okay. We can measure the size of it quite well, just a little breath in. Okay, we can measure the size of it from here to here. We can exclude a hydronephrosis, we can exclude a tumor. And those are the main simple things we want to do. As we get a little bit more advanced, then we'll start looking at some more advanced anatomy in it. Now you use a very similar position to try to get the left kidney. And you can see that's immediately underneath the spleen here. It's a little more difficult to get because colon is around here and there's no sort of window. There's no acoustic window. You see, I'm actually using the tip of the spleen and then I'm going through a bit of muscle to get this. So you don't necessarily get the best images of the kidney very easily. You can use your little cine thing here to try to improve the image. Again, you see the collecting system, and it's normal. You can measure the size of the kidney, and that's the best position to get the left kidney. Then a decubitus scan, like that, showing spleen on the left and kidney on the right. Here that we couldn't see on the other scan, you can see these sort of black spaces here. You couldn't see them when we were doing it before. And these are the pyramids. These are normal anatomy.
Right.
You can see them quite nicely.
Abnormalities found within the kidneys include hydronephrosis, simple cysts, complex cysts, stones, and tumors. A hydronephrotic kidney is one that usually is obstructed. Instead of seeing a single white line in the center, you will see two white lines with fluid in between. Simple cysts within the kidney can be identified by their blackness. You will see a completely black area with smooth walls and no echoes. There will also be some increased brightness of the image beyond the cyst, called enhancement. These cysts can be found in the kidney, in the cortex, peripelvic, or even hanging off the kidney. Complex cysts within the kidney are irregular and not completely black. Masses appear as a solid white or grayish object within the kidney, or hanging off of it, without enhancement behind them. Stones in the kidney appear as a white mass. Because they absorb all the sound energy from the ultrasound beam, a definite shadow is seen behind them. For small stones, it is essential to have the focus at the level of the stone to show the shadow. A basic AIUM hepatic exam involves the investigation of the liver, gallbladder, common bile duct, and pancreas. Liver size will vary with the size of a patient. However, a normal liver should weigh between 1,200 and 1,500 grams and should not extend below the lower pole of the right kidney.
Starting off with the left lobe of the liver, you can see stomach here, inferior to this part. We're looking at the surface of the liver. We're looking at the texture of the liver. We can see the heart, ventricles beating up here. As we come here, we see the aorta, a couple of branches here of the celiac artery. Coming up, now we're in the midline. Here's the caudate lobe of the liver with the fissure for the ligamentum venosum here. As we come over a little bit more, here's the inferior vena cava and the middle hepatic vein here, the inferior vena cava emptying into the right atrium. Again, we see the stomach. As we move over, it'll come into the antrum of the stomach. Next section over, we begin to see the kidney behind here, but we see the main portal vein and the left branch of the portal vein coming up here. Again, nice normal texture around here. And then we're coming on through the liver and out into the gallbladder, here. There is an artifact here. You can see that there's some echoes in here, and the more subcutaneous fat there is, the more you'll get these echoes. It's what we call a second time round echo, and it's due to the fact that some of this energy is reflected off probably the rectus and fat interface, and it goes back, and so it is. And then it goes around a couple of times so that the anterior abdominal wall is repeated in the first few centimeters of the tissue. And you notice that in where there is a fluid-filled organ like this. As we come laterally and come out through the right lobe of the liver. Okay, now I'm going to go transversely. And if we go right up, we can see the ventricles very nicely. Coming down, we're going to see the three hepatic veins joining together here, coming into the inferior vena cava. And on the transverse view, as we come down a little bit further, we can see the portal vein, the left portal vein there going out, and then going into the right side, we can see the right portal vein here, dividing into an anterior and posterior branches. If you could just try and hold your breath for a moment, I'll try and show that. Now the gallbladder we can look at quite rapidly, transverse, longitudinally.
A normal liver will have a smooth, uniform texture with no defects except those from blood vessels. Normal hepatic veins found in the upper part of the liver are thin-walled. Portal veins are easily identified by their very distinct, very white walls. Abnormalities of the hepatic veins include dilation. Dilated hepatic veins are commonly seen in response to reduced cardiac output. In this patient, one can see the massive engorgement of the hepatic veins due to severe heart failure. The IVC is also seen to be large.
Now, if you have a problem seeing the liver, just ask the person to just breathe in, would you please? Okay, beautiful. Just breathe in and out. Now you can see that this hemidiaphragm is moving beautifully. So if you have any suspicion of phrenic nerve injury or involvement by tumor, this shows you the diaphragm is moving very nicely. Again, we can see the normal texture of the liver, the smooth surface. And of course now we're coming into the gallbladder. Some people you can't scan subcostally like this, even when they've taken a big breath in. Some people have their liver so high that you have to go intercostally. But vast majority of people, if you ask them to breathe in, they'll give you a liver window beneath the costal margin, which will give you the optimal images that you can get.
Abnormalities of the liver include cirrhosis, hepatomegaly, and masses, which may be cystic or solid. This is an enlargement of the surface of a cirrhotic liver. Notice how edges of the liver are irregular, not smooth as in a normal liver. Hepatomegaly is an enlarged liver. A liver that extends much below the ribs or the lower pole of the right kidney is most likely enlarged. Frequently, this is just due to diffuse fatty infiltration, but it may be due to extensive benign or malignant disease. You can find both benign and malignant masses in the liver with ultrasound. The most common benign mass is the hemangioma, usually a small white mass which occurs in 1 to 2% of the normal population. Other less common benign masses include focal nodular hyperplasia, focal fat, and the rare hepatic cell adenoma. Simple cysts are not uncommon. Malignant masses may appear as holes in the liver texture, hypoechoic, or as white masses, hyperechoic, that appear superimposed over liver tissue. These latter masses are most frequently seen in gastrointestinal metastasis. In this patient, the hepatic bile ducts are abnormally large, indicating an obstruction. While the intrahepatic ducts were dilated, the common bile duct was not affected and was normal in diameter. The pancreas and pancreatic duct were normal as well. The obstruction was caused by a very large hepatocellular carcinoma tumor detected in the posterior aspect of the liver. The tumor is seen here as the irregularly shaped darker areas within the liver parenchyma. This mass was large enough to grossly distort the shape of the liver and right kidney. This patient was diagnosed with AIDS and hepatitis C.